Alright guys, welcome to another video. I am Dr. Leanna, owner of ChiroFit. If you are new to the channel, welcome. I am a chiropractor and today's video is about low back pain. I am treating my sister, she's the patient, and she's had some low back stuff happen in the past. Spondylolisthesis, a grade 1. We both have it actually, and I've made videos about it before, but essentially all it is L5, the lowest vertebrae in your low back. We both have a stress fracture through the pars, and it's part of the bone. And so L5 shifts forward a little bit, causes a lot of pain. It does not feel good. Through chiropractic and self-care, it's definitely manageable. So she said, she reached out to me a couple weeks ago and said that she was having a lot of pain, more pain than usual. So I usually adjust her just to keep her healthy, but we've been a little bit more aggressive with her care, more therapy stuff, so the cupping, the hypervolt, some stem EMS, and then we've been taping her too, which she's never had in the past, but she said it feels good. It just kind of helps to reinforce that area, make it a little more stable. And so yeah, that's basically the extent of what we've been doing, and as well as therapeutic exercises. So that's gonna be the video. Hope you guys enjoy it. Give it a thumbs up, subscribe to the channel if you are not already, and I will see you guys in the next one. Even lower? Like where, here?
No, down.
Yeah.
Here.
Okay. But nothing going down to your legs, right?
Correct.
Okay, good. Good. So like right around those two bones?
I think so.
Yeah. There we go. Yeah. Good. Okay, that's all we need then.
Okay.
Back.
I've been stretching.
Does it feel tight to you? I feel like it's a lot better than the last time.
Stretching and doing core exercises.
Yeah.
So I think it's helping.
What kind of core?
Oddly enough, but
What kind of core stuff?
like bird dogs and
Good. I was gonna
or dead bugs and bird dogs.
Okay. I'm gonna have you do a dead bug for me.
And I feel like after I do dead bugs, like my back feels better right away.
Yeah, they do. That's what they're like.
Rehab.
Top 5 rehab exercises.
It's like people don't know how to use their core, like literally at all.
No.
It's crazy. And you know how many core exercises they do in their life?
Yeah.
You know?
You know why so many people have back pain?
Because they can't even use their core.
Yeah, it's like literally all their weight is in their back.
It's crazy.
It's bad.
Well, I thought it was like working all of this. No. If you're feeling a plank in your back, you're not doing it right. Planks are not meant for your back. That's because you're putting all the stress to your back. You're not activating your core.
People are very undereducated about that.
Like,
because I'll tell people, I'm like, stop doing crunches, let's put you over the planks. And they're like, ugh. I'm like, if you're actually doing these right, this is what's going to build a six-pack, not your stupid...
I can't do a plank, it hurts. That's too much on my back. Oh, really? Tell me more.
Like, there's so many better machines you can be doing than a stupid quad extension, which most of the population doesn't need anyways, because we're also forward weight bearing.
Right.
It's just like it's a waste of time to sit there and do that. Like, do something productive with them.
Right, like learn how to do a step up properly or something. Right,
something more useful for their life instead of sitting on a chair, which they do all day anyway, and raise their leg and not use any of the right muscles and pretty much put all the stress on their knee. Yeah.
Because again, they don't even know how to properly activate their quads.
Exactly.
So they're
That's
just
what I'm
like
saying.
Sending the stress out.
All in their, they're just moving their legs.
Like they can lift the weight, but bringing it down, woo, it's like whoa, use your fucking muscle to bring the weight back down.
That's what I just don't get, too. I don't think I've ever done that. I mean, I've done a lot of stuff wrong, but not just, like, out of control like I see people do. I'm just like, do you feel anything right now? Like,
this is so easy. I'm like, no, it's because you're doing it wrong.
Right. Do a... dead bug, sorry. Come though so you're totally flat. Yep, and then do it for me. And next I'm going to alter it because this is too easy for you. Come up in the position again. Okay, go one leg, one arm. Okay, push as far as you can with this leg. Twist it in a little bit. Come like that. And then reach. Open up the palm. Yeah, there you go. Reach with your head. Tall as possible. Beautiful. Second touch. Good, bring back.
That's hard.
See how much harder that one is? Okay, do that again. Other arm moving. Other arm moving. Good, reach. Extend through. Yep, tuck it, there you go, tuck it. Beautiful. Come back. Was one side harder for you?
Yeah, this side.
I noticed that too. Yeah. Okay, good. And then once you get good at that, start using a band. Okay, so we are going to do some of the TheraBand KT tape on her. I have mixed feelings about it, but she is having a lot of pain in her low back, specifically around the SI joints. So we're just going to try this just to make her low back a little bit more stable, because that's what I think it needs right now. So 3 total strips, 2 long ones, 1 short one. So I'm going to put it on and then I'll show you guys kind of how it looks when it's done. Okay, so this is what they call the H pattern. You got 1 strip there, 1 strip there, and then 1 at the base, kind of along the sacrum. And then we're gonna put some of this BioFreeze on there. I've talked about this before. You can get it in Walmart, but the Walmart brand is not the professional brand. So, AKA, the Walmart stuff sucks. So, put a little... Oh man, move your hands. Actually, I don't want to get on your fingers. Okay. Do you think that's enough? You feel it?
Yeah.
Okay.
Thank you, Tiara. You're awesome.
You bet, buddy. How does it feel?
Good.
You like it, kind of?
I don't feel pain. I'm being serious. That's when it hurts the most, is when I do this.
You bend over.
Like,
yeah.
When I pick up, like, something like that.
Yeah. And this is a classic thing that people will tell me is, like what she just said, when they bend over. And unlike her, she actually knows how to engage her core so that it takes the pressure off her back, but since she already has kind of like her back's flared up a little bit, it aggravates it. But for the normal population, people do not know how to engage their core. So when they bend over, it's putting all that stress on their low back, and that's how people injure themselves. So we went through the dead bug, which is a superior rehab, low back rehab exercise. So right on.